Greetings to Yoshinaga Un, Mayor of Matsumoto City, Dr. Takeshi Kasai, WHO Regional Director of the Western Pacific, Hiroshi Komiyama, Chair of the Mitsubishi Research Institute, Hiroyuki Tsutsumi, President of Philips Japan, and Minoru Uemura, Director of the Business Promotion Department, Monet Technologies, the citizens of Matsumoto City, and everyone in attendance at this conference. I'm Audrey Tang, Taiwan's Digital Minister. First of all, congratulations to Matsumoto City for successfully holding the 10th World Health Capital Conference. Your city has to date held many advanced events in the domains of health, welfare, and education in Japan. In 2015, Matsumoto City signed a Memorandum of Understanding in the domains of health, welfare, and education with the Taiwanese city of Kaohsiung, after which medical personnel, as well as elementary and middle schools, developed close relationships of exchange. Among these relationships, I have been in contact with Yamaguchi Yukifumi, the former Deputy Director General of the Japan-Taiwan Exchange Association's Kaohsiung office, who pushed for the signing of the Japan-Taiwan Memorandum and is currently a visiting professor at Chiba University of Commerce. We have attended many conferences together, held in Taiwan, and this round, the 10th World Health Capital Conference, is held in Professor Yamaguchi's hometown, and I'm so honored to have been invited to attend through video conference. Today's subject is the world after COVID-19. The question of utmost concern to the world at present is how to respond to post-pandemic developments. To that end, our Taiwan model in applying digital technology to governmental policy and thereby resolving the many issues presented by the pandemic has received much attention. A detailed explanations will be given in a video that will follow shortly, which I invite you all to consult. Hello, I'm Audrey Tang, Taiwan's Digital Minister. I'm really happy to be here virtually to share with you how Taiwan countered the pandemic with no lockdowns. But first, I would like to say that social innovation, that is to say, the people who trust each other to innovate on how to improve as we encounter a novel situation, a novel coronavirus in this case, is really the cornerstone of Taiwan's collective intelligence. In Taiwan, we have the fast, fair, fun as the three pillars of social innovation. I'd like to talk first about the fast part. Democracy improves as more people participate, and digital technology remains one of the best ways to improve participation, as long as the focus is on listening at scale, not just broadcasting, and finding common ground and rough consensus rather than sowing discord. So whereas many economies began countering the coronavirus only this year, in Taiwan we started last year, and we thank Dr. Li Wenliang from Wuhan, the whistleblower, who posted that there were 7 new SARS cases last year. In the Taiwanese equivalent of Reddit, the PTT, there's someone with the name No More Pipe reposting Dr. Li Wenliang's message on early morning of December 31st. And it got upvoted so that our medical officers immediately noticed this post and issued an order that says all passengers flying in from Wuhan to Taiwan need to start health inspections. And that was the first day of 2020. It says to me 2 things. First, the civil society trusts each other and the government enough to talk about possible new SARS cases in a public forum, and that the government trusts the citizens enough to take it seriously and treat it as if SARS has happened again. It's something that we have been always preparing since 2003. And the reason of this trust is because, according to the Civicus Monitor, the Human Rights Watch group, Taiwan is the most open, indeed the only completely open society in the whole of Asia. We enjoy the same freedom of speech, the same freedom of assembly, the same freedom of the press, and so on, as other liberal democratic countries, but with the emphasis on keeping an open mind on novel technologies, because in Taiwan, democracy itself is a technology. We only got to direct presidential election thanks to the late President Li Denghui in 1996. And there's a saying that anything that's invented after we're born is technology. So in Taiwan, we're constantly looking at ways to improve democracy as a set of social technologies. One example. Every day, our Central Epidemic Command Center during the pandemic holds a live-streamed press conference. And the simple collective intelligence system in this case is a toll-free number that is 1922. Anyone with any idea coming in from the civil society can just pick up their phone and dial this number. Not only there's more than 90% chance of it getting picked up, you can actually ask anything about epidemiology as well as contributing your thoughts to the CECC daily press conference. For example, there was one day in April when a young boy's family called saying, hey, my boy doesn't want to go to school because their schoolmates may laugh at him for wearing a pink medical mask. You see, when you're rationing mask, you don't get to pick the color. Well, the very next day, everybody in the CECC press conference started wearing pink medical mask, making sure that everybody learns about gender mainstreaming. And the person in the middle, Minister Chen Shizhong, our commander, even said that his favorite childhood icon was the pink panther. And this kind of fast response builds trust between the government and the civil society. Another focus here is fairness. For example, when we ramped up the facial mask production, making sure that everybody can use their national health insurance card to collect masks from nearby pharmacies, fairness is the guiding principle. But the system to distribute the mask was not a government technology project. In the beginning, it's a GovZero project. In Taiwan, for each government website that always ends in something.gov.tw, for example, our national participation portal is join.gov.tw, the civil society, the civic hackers, can always change the domain name from the O to a 0. So once you do this change in your browser bar, you get into the shadow government that uses the same data, the same ideas, but take it to a different direction. And we call it forking the government. Important pronunciation, fork the government. Fork means not erasing what's already there, but taking it to a new exciting direction. And because the GovZero movement always relinquish the copyright of the work, actually mostly using the MIT license, people can very easily change that source code also to try different variations. And at the end, if there's something that's really liked by the general public, the government can always take it in. One example is that there is this map that was created by Howard Wu or Wu Jiangwei from Tainan City. In early February, he observed that when people go to the nearby stores for mask purchase, there's no telling which store runs out of masks and which store still have them in stock. So instead of relying on social media, which may not be up to date and also is quite chaotic, he created this map similar to the Ushahidi map, where people can voluntarily report which convenience stores, which pharmacies near their places still have masks or whether they run out of masks. The only problem about this is that, well, because he used the Google API, soon the API usage is astronomically high, so he cannot afford to run it anymore. So he joined the GovZero movement's Slack channel, asking, are there better ways to cache the result or to use OpenStreetMap or use some other technology to relieve him of the budget burden. Now, I'm one of the people in the GovZero Slack channel that contributed to the discussion, and it occurred to me that this system is much better than the system that we posted online from the government side about the availability of masks. So I just went to the premier, Su Zhenchang, saying, hey, this young person here has a much better idea of how to visualize the mask availability, and we need to do all we can to support him. And this is what I call reverse procurement. In traditional procurement, the government sets the specification and the citizens, the economic sector, implements it. But here, the social sector sets the expectation, the specification. The economic sector, such as Google, eventually waived the API usage fees. And at the end, the public sector's role is just to implement what the social and economic sector wants in a way of realizing the real-time API of our National Health Insurance Agency to make sure that everybody gets access to the level of mask availability in each pharmacy. There were more than 6,000 of them every 30 seconds. And that's why people can participate in accountability when they're queuing in line. Everybody can look at the map or the chatbot or voice assistants. There's more than 100 different applications of the same open data in API form. And if they swipe their NHI card and go to a pharmacy who shows at this moment 58 adult masks available, then they would expect that after the person before them swipe their NHI card and collect 9 medical masks, then 58 minus 9, that would be 49. And so everybody would then expect that this sort of like distributed ledger, because each map visualization, each toolkits provider have a copy of the real-time API to be consistent. But if instead it doesn't go to 49, but go to, I don't know, 60 or something, they will call 1922 right there. And so this participatory accountability makes sure that the pharmacists earn the trust by opening up their real-time stock, and the civil society earn each other's trust by making sure that each transaction is indeed fair. And because the NHI, the National Health Insurance, covers more than 99.99% of not just citizens but also residents, people who show any symptoms will then be able to take the medical mask, go to a local clinic, knowing that they will get treated fairly and without incurring any financial or social burden. And this also enabled the civil society to build dashboards. In this dashboard, we see that we're indeed ramping up the medical mask production. This is the point where we switched from distributing 3 masks for adults per week to 9 medical masks per 2 weeks. And so the supply is indeed growing and people can see it in real time. And there's also people who analyze this and shows us where in Taiwan do we have an oversupply or undersupply. And the pharmacist also has real-time feedback on the kind of supply levels, the people's queuing behavior and so on, and they can always report it in the real time so that they receive supplies as well as the ordering system is always co-created with the entire society. And based on this analysis, we saw that even though that we reached about 75% of people collecting medical masks and using it regularly, the numeric model shows us that to reduce the R0 value to be under 1, it's not enough to only have like 70% of people actually wearing the mask. We need to get to more than 75%, ideally 80%, so that the R value will be under 1. So we asked the remaining 1/4 of population, and based on the dashboard and the focus group, they told us that many people who work in the science parks, like near the Taiwan Semiconductor Company in Hsinchu, or in the financial sectors in the Taipei or New Taipei cities, they work very long hours, actually a longer working hour than the pharmacist. And so before, when we only rationed through the 6,000 pharmacies, they could miss the mask collection simply because, well, after they went off work, everybody from the pharmacies have already went home. And so we need to ensure fairness of all kinds. And that's when we started in early March to work with convenience stores, which opens 24 hours a day. And we use the NHI app, which can validate that you are indeed the person that registered in the NHI using the mobile provider's TWID identification. so that you can authorize that app the access to your SIM card. And if your SIM card is registered to your name and it matches your NHI card, then you can use that app as your NHI card and pre-order the mask to your nearby convenience store. And so you see our Premier Su Zhenchang smiling very happily here. And that's because that's the day we started working with convenience stores. And because the convenience stores also served many people, there's more than 12,000 of convenience stores. And then they also joined this co-creation, telling us that even though that this moved the mask availability well above 80%, there's still like 10% or so who could not access the service, either because they do not have a mobile phone, like they're of the very elderly and they could not queue in the pharmacy either, or maybe they're migrant workers who do have a national health insurance card but do not have the mobile phone to their name. Maybe they use prepaid SIMs and so on. And so in early April, we further improved the system so that anyone with the NHI card can just go to any kiosk in their nearby convenience store, insert the NHI card to pre-order to the same convenience store to collect it a week afterwards. And that's when we distribute the mask to more than 95% of the population. And so we ensure fairness of all kinds. And I would also like to share the fun part in fast, fair, and fun. Because this is a stressful time and people do feel anxious. There was a lot of panic buying, a lot of conspiracy theories. And in Taiwan, our counter disinformation strategy is based on this simple idea. It's called humor over rumor. One example, when there was panic buying of tissue papers, there was a rumor that says, and I quote, "There is a same material of the medical mask that's being produced in the tissue paper factories, and these were being rationed out to the medical mask production facility, so we will very soon run out of tissue papers," unquote. Of course, that's not true. The tissue papers and the medical masks are not of the same material. But because this travels outrage, it maybe has a R value of 3. Like every hour, on average, each person would share to 3 people on social media. And so there was panic buying. And the same premier you saw smiling in the previous slide, after not even 2 hours, wrote this meme out. And in this internet meme, in this picture, the premier Su Zhenchang shows his backside, wiggles his bottom a little bit, and say in very large print, each of us only have 1 pair of buttocks. And it's a wordplay, because in Mandarin, 囤 to stockpile sounds the same as 囤 buttocks. And so this is, of course, hilarious. Many people laughed about it. And because this travels on joy, on humor, it has maybe a R value of 5. So even if this rolls out after the original conspiracy theory, after a day or 2, this reached more people. And there's also a table here that says, the tissue papers came from South American materials, but then the medical mask came from domestic materials. So they're completely different. There is no need to panic buy. And of course, people who laughed about this specific meme is literally unable to feel outrage because, well, that they've laughed about it. And the fact-checking can then enter effect. And so we finally found out the people who spread the conspiracy theory in the first place, and they were tissue paper resellers. Anyway, this was not just a single shot point in the social media. This kind of vaccination of the mind is very important in our CECC daily press conference as well. You see, in each ministry, there is a team of what we call participation officers, or POs, just like media officer that talks to the journalist and the parliamentary officer that talk to the MPs. The participation officers talk to hashtags. Whenever there's a trending emerging hashtag, such as the conspiracy theory about tissue papers, the participation officers need to engage the hashtag. Instead of inviting the representative, there's no representative for most hashtags, one would just engage the hashtag, and to share hilarious memes that always is inviting and make sure that scientific humor, the clarification, spreads easier and wider and invites people to co-create it. And so our Ministry of Health and Welfare's participation officer lived with this dog, this Shiba Inu, and the name is 总裁, or the dog CEO. That translates the physical distancing signs on the top left corner. For example, if you're outdoor, you have to keep 2 Shiba Inu away from one another. If you're indoor, you need to keep 3 dogs away from each other. Or the sanitation, hand sanitation importance. Remember to cover your mouth and nose when sneezing. Don't do what this dog does. Or remember to pre-order your mask. But why don't you just wear the mask? Because wearing a mask is not very useful unless you also wash your hands with soap. And so we always connect the 2 memes together. And so you order the mask in order to protect you from your own unwashed hands. And this is what this picture is saying. The mask is here to protect you from your own hands. And please use a soap to wash your hands much more diligently. And so that's how we make sure that Taiwanese people still feel calm and collected, even during the pandemic. IT is about machines. Digital is about people. As Taiwan's digital minister, it is my sincere hope that people in the 10th World Health Capital Conference will come together and further our understanding on how digital social innovation can serve as our societal infrastructure and promote sustainable ways of living. Thank you everyone for listening. Live long and prosper.